1/3 of the world's population is infected with Mycobacterium tuberculosis. Over 9 million people a year develop active tuberculosis, and mortality approaches 2 million deaths annually. Tuberculosis is an enormous global health problem that disproportionately affects the underserved. As tuberculosis is spread in the air, infection impacts the health of the entire community. Alarmingly, we are now experiencing increases in multi-drug resistance and extremely drug-resistant tuberculosis infections in developing countries, with unusually high rates in Mexico. Sadly, we have also observed the development of totally drug-resistant tuberculosis, that is, untreatable TB. As we live on the border, tuberculosis control is vital to the health of all in our region. For years, the city of Tijuana has struggled with high TB rates in comparison with the rest of Mexico, and TB rates in San Diego are higher than many other parts of the United States. Why is this happening? TB can be cured. The principal reason for the emergence and rise of resistant tuberculosis is incomplete drug therapy. The World Health Organization states that tuberculosis should be treated with directly observed therapy, where the healthcare worker watches the patient swallow their medications. This system is inconvenient, time-consuming, and expensive, and because of this, incompletely implemented even in the United States. The situation in developing countries is far worse. Within our own district, if you look at the distances involved over which we have to treat patients, we have 8 TB nurses and 8 dot workers to cover over 4,500 square miles. Again, these situations in developing countries are far worse. The Alliance Healthcare Foundation has awarded the University of California, San Diego funding for a trial using a brand new wirelessly observed therapy technology, or WOT, to treat tuberculosis, and to compare this with directly observed therapy, or DOT, for TB treatment. The technology is based on the use of the first ever edible sensor to remotely confirm ingestion of tuberculosis medications. The system consists of a tiny sand grain-sized ingestion sensor made of food materials, very tiny amounts of the same ingredients as found in a standard vitamin tablet, and a small adhesive monitor patch that is worn on the patient's torso. When ingested, the sensor is energized using gastric electrolytes and communicates with the adhesive-backed monitor patch worn on the torso. The communication process is not dependent on gastric pH or stomach content and is similar to a heartbeat communicating to an electrocardiogram. It is unnoticed by and not detectable beyond the system user. The ingestion data are stored on the patch and are then automatically sent wirelessly to the paired mobile device. The data on the paired mobile device is subsequently uploaded to a secure data server using encryption protocols that are used for secure banking and healthcare. Using this information, the system can provide the date and time of medication ingestion, the number and types of medication taking, the doses, the drug supply chain, and using the secure web-based interface to access the data server, approved healthcare providers can confirm remotely that the patients have taken their medication. Ucsd has established agreements with Health and Human Services Agency San Diego and Proteus Digital Health, the original designers and manufacturers of this product, devised a full randomized clinical trials protocol and are currently comparing wirelessly observed therapy to directly observed therapy in San Diego. Our patients come to our clinic. We show them how to put on the adhesive patch. We show them how to pair the patch to their mobile device. Patients soon learn how to do this themselves. We also provide them with sensor-enabled tuberculosis medication that is made in strict quality control environments by qualified personnel. When the patient takes these tuberculosis medications, they are able to see their ingestions on their mobile device, which has been paired with the patch. We show the patients how to access this and how to look at their own medication ingestions. They can also see their exercise and activity in the last 24 hours. Patients are able to track their medication ingestion over a day, over a week, and over their entire tuberculosis treatment. This helps to support their medication taking behavior. And healthcare workers who have access to this can also see when their patients have taken their medication remotely. The AHF has enabled us to work with the underserved to implement groundbreaking technology for tuberculosis. We are currently testing wirelessly observed therapy in comparison to directly observed therapy in San Diego. WATT is demonstrating its ability to provide monitoring over a 7-day period throughout weekends and holidays. This trial will also have substantial significance for the underserved globally, where wirelessly observed therapy offers a complete treatment, monitoring, and recording system with minimal infrastructure needs.